You know what? For essence of time, we are going to go ahead and get started. Hello, everyone, to the February Government Affairs Council meeting, the first of the year, actually for us, because do we meet? I don't think we met in January. So, good to see everyone here, and we're going to get start with introductions. Really excited for today's conversation. I am Diana Batista. Day job is with Lucille Packard Children's Hospital. I'm going to pop over like popcorn style, so get ready. We're going to go to Ginny.
Hi, Jenny Lear, yes person, community member. Thank you, and fan of Tom's for sure. Thank you.
Scott.
Right. I had to check there, make sure I was the only Scott today. Good morning, Scott Hunter, Executive Director, Los Altos Village Association. I'm also on the board of the Los Altos Stage Company.
Mark.
Mark Seidel, Chamber Board member, professionally work for a private family office, and I volunteer all around town.
Tim.
Hey, good morning, everybody. Tim Giacomini with Mission Trail. I'm actually in the car right now, so I apologize, but I will be on a listen only today, all right? Hope everybody's having a good day.
Sounds good. Thanks, Tim. Miss Julie Rose.
Community member and also a member of Tom's fan club.
Marie Young.
Good morning, everyone. Marie Young, volunteer at CSA, and on leave temporarily with a broken arm, but I also need to leave in order to be at a 10 o'clock meeting.
Sounds good. Sounds good. We're going to include our staff. Kim.
Thank you for joining, though, Marie. I'm sorry to hear about your arm. Kim Mosley, President of Los Altos Chamber of Commerce. Great to see everyone here this morning.
And Miss Nicole.
Hi, I'm Nicole, also with Los Altos Chamber.
Thank you. And Marie, I am sorry about your arm. My sister sprained her wrist, which leaves me on dish duty, which makes me not happy, but that,
Yeah, my husband has been great about cooking meals and stuff, so
good.
I'm set.
Gotta have that support.
Yeah.
Okay.
Yeah.
We are so excited. And I love the fact that this is like a fan club for Tom. And because there really is no one who should have a bigger fan club. Tom, just for the community to know, for 26 years, Tom Myers has been the CEO of Community Services Agency of Mountain View and Los Altos, otherwise known as CSA, the primary nonprofit provider of social services to low-income and homeless individuals and families in our community. He has worked for nonprofits for more than 35 years in areas as varied as civil rights, aid services, consumer advocacy, and international development. His love of public service began as a Peace Corps volunteer in the 1980s in Africa. Tom served on the board of directors of United Way Silicon Valley. He served as president of the Bay Area Municipal Elections Committee. He has been president of the Mountain View Rotary Club twice, and he is a past chair of the board of directors of the Mountain View Chamber of Commerce. Tom is currently the chair of the Emergency Assistance Network of Santa Clara County. He sits on the board of directors of Hope's Corner, a food program that serves hot meals 3 times a week. He is also on the board of directors of Altos Housing, a nonprofit developer of affordable housing. And it's not on this short bio, but I don't know how he does it all and still hadn't managed to travel across all the continents on this globe. So he's a very busy person, and I love that. We are here today because the topic is the effect of federal funding cuts and policy changes on our local safety nets. And I don't think there's a better expert on this matter. So without further ado, Tom, the Zoom is yours.
Great. Well, thank you, Diana. Much appreciated, and thank you all for being so complimentary to me during the introductions. In fact, my husband and I leave for New Zealand on Friday evening, so we're off, once again. But it's that you mentioned the Peace Corps volunteer, and I love my job at CSA. But if someone were to say to me, "What's the best job you ever had?" it would be a very close one between this one, which I truly love, and my former job as a Peace Corps volunteer, which I actually did for 3 years. Usual term of service is 2, and I loved it so much I asked to extend for an additional year, and they allowed me to do that, which was great. And I lived in Liberia at the which was in the news a lot. Seems to have settled down, but was in the news a lot because of the civil wars and everything. But that's where I have my love of the planet. And it's not like I know that there's a real draw to go and stay at 5-star resorts and stay on the beach and everything. And no, we tend to be trekking around in jungles and things like that. So we'll save the beach resorts for when we're a little bit older, maybe. But yeah, I love that. But I also have always, no matter where I went in the world, it was a real strong desire to come home. This was home to me, Mountain View and Los Altos, and I grew up right on the border of Mountain View and Los Altos, both. Uh, and this is my hometown. My parents still live in the same house they've lived in since the early 70s. So it's a pleasure to serve this community and to serve it in a way that I think is really special. Enough about me. Let's talk a little bit. I think almost everybody on here that I can tell knows about CSA, but I'm going to share a very quick slide presentation about so people know about CSA. Even if you know CSA, you may not know everything we do. So I'm going to go through very quickly a slide presentation, and then does everyone see that?
Yes.
Perfect. Okay. And I can still see you. That's fantastic. Okay. This is a quick overview of CSA. And we are a safety net. A lot of people don't realize how old and ingrained we are. Been around since 1957. We were started by volunteers from both Mountain View and Los Altos. We also include Los Altos Hills. And we are a member of the Emergency Assistance Network. This is very important. People do not know. It's like the best kept secret. The Emergency Assistance Network is a network of 7 organizations that make sure that all parts of Santa Clara County, all parts of Santa Clara County are covered with basic safety net services. So you might hear about a group called Sunnyvale Community Services. They serve Sunnyvale. You might hear, and Alviso, by the way, or West Valley Community Services. They serve Cupertino, Saratoga, those points south. Sacred Heart Community Services, they're in downtown San Jose. All of us are part of this thing called the Emergency Assistance Network. And the Emergency Assistance Network is that group of organizations that make sure that people have access in all parts of our county. Our programs include homelessness prevention and homeless services. We try and prevent people from becoming homeless, but we also help them get into housing or some sort of shelter if they are homeless. And just to quickly answer the question that a lot of people ask, if you are living in an RV, you are considered homeless.
Welcome to Zoom. Enter your meeting
What?
ID, followed by pound.
Sorry, Tom. Can I ask folks who are not speaking or to be on mute? Thank you.
All right. Yeah, so homeless prevention, though, is very important because it's a lot cheaper to keep someone in their home than it is to try and get them into a new home. We have senior services. These are case managers, nurses, and others who work with seniors in the community. This is particularly important in Los Altos. We work with low-income seniors, and low-income seniors exist in Los Altos, whether we like to believe it is true or not. We do outreach and advocacy. We have people who go out into the community to take services into the community. We have one young man I was just talking to in the hallway as I was getting my coffee this morning who works in the high schools. And he goes out and makes sure that people have access to CSA services in the high schools. We do senior nutrition. We have a senior nutrition program, lunch every Monday through Friday at the Mountain View Senior Center. And our largest program is our Food and Nutrition Center. And in fact, there's a semi truck from Second Harvest Food Bank making a delivery of some of their food. Second Harvest is one of our donors of food, an important donor of food. It's not our only donor of food. We have a wonderful relationship with Hidden Villa, which I know Mark knows very well from previous years, that where they give us poundage from their farm. We also have relationships with almost every local grocery store in Mountain View and Los Altos, and they give us
Okay.
food. Yeah. And
Thank
then
you.
perhaps the most important thing is the food that we are able to go out and purchase. And I'll get into that in a little bit when I talk about federal funding cuts. Some numbers, and I don't need to go deep into the numbers, but just to let you know that our Food and Nutrition Center serves almost 3,500 people a year with literally hundreds of thousands of pounds of food and produce going out. We have mobile pantries that go out into the community, and we try and make sure that it's mostly healthy. So 75% is healthy. I did go down the other day and saw that someone had donated some Hostess Twinkies, and that's all right. I'm not going to begrudge someone their Twinkies. However, we do try and make sure that it's mostly, kale and spinach and potatoes and tomatoes and things like that. Homeless prevention services. We've served over 3,700 people in homelessness prevention, and over 395 people got financial assistance. That financial assistance can be anything from help with rent for a month, or it can be help with paying a medical bill, or it could be help with utilities. PG&E is about to be shut off or something like that. One thing that's very important to remember, and everyone here I'm sure knows this already, CSA is very strict about doing income verification. So income verification is very important. That means that you can't just come in and say, give me a check. We have to go through a whole process. And I know that can be very, very tedious, but it's required by our funders. And we have no choice but to do that, to go through that process with people. Now, there are other groups, like you heard, I sit on the board of directors of Hope's Corner, the soup kitchen. They just open the doors. Anyone can walk in and get services. And there's a place for that too, especially if you're doing a soup kitchen. And I can guarantee you that the majority of people who are going in and getting a free meal are low income. No one's going to go to a place like that if they don't absolutely need it. But that said, CSA is very, very strict that we only serve low income or homeless individuals, and we do income verification for that, financial assistance. Our homeless services, official count, and we hear a lot about the point in time count. The official count is approximately 879, but we have over 1,000 people registered for services. What that means is that we all know official counts always undercount a little bit, but that's the number of folks that are coming to us for services that are considered homeless. This shocks people, and I will say this forever and always because this is particularly important. The fastest growing demographic falling into homelessness is older adults. People are shocked when I say it's seniors that are falling into homelessness because their idea of homelessness is that man, usually that man, middle-aged man, sleeping on a park bench or whatever. No, if seniors are falling into homelessness, and that's our fastest growing group falling into homelessness, and they're living in cars, vehicles primarily, they're couch surfing or whatever. And it is heartbreaking because these are people who have lived in the community for a long time. Their doctors are here, their churches are here, whatever the case may be, and they can no longer afford to live here. And so we do have, like I said, a number of senior services. This is particularly important in Los Altos. We do senior case management. We do intensive case management. These are people who need a little extra hand. So a senior case manager may have a client load of, say, 40 or 50. An intensive case manager may have a client load more like 10. We have registered nurses on staff. We do senior grocery delivery. This is a program I'd like to see extended. It's always hard to get people who are available to go and deliver groceries. Marie's probably been one of those people delivering the groceries. Or if not, she's at least in the food center, seeing people collecting food to take out to the seniors. Our senior lunch program, and we do transportation of seniors to doctors and so forth. This is not a program we want to put out there because there's a lot of seniors who are not necessarily low income who need transportation assistance. And so we would have to go through an income verification with all of those seniors, and that would not be appropriate. So that's one that we do, but it's a very kind of low key. And then under senior case management, we had 207 participants. 97% of these we were able to keep in their homes independently. And this is really important. A senior would rather live at home. I'm dealing with my 90-year-old parents right now. They would much rather stay in that house they've lived in for 50 plus years than go over to the terraces or the forum or wherever might be appropriate. This is their home. This is where they want to stay. So for a low income senior, even if you're living in an apartment, you would rather stay there than go into a nursing home. And in a nursing home, especially if it's a Medi-Cal or Medicare, a Medi-Cal nursing home, it's much cheaper for them to stay at home too. And then our senior nutrition program, 45,000 hot meals to seniors every year. And about 14% of our people in that program are from Los Altos. So anyway, I'll stop with the sharing right now for this, and then just talk to you real quick about if there's any questions about CSA and the work that we do. I'm also happy then to go ahead and start talking about the main meat of it all, which is our current funding situation. Any questions about CSA as an organization that I can answer real quick? Oh, hi, Tori. See, you're on there. All right, great.
No
Then I'll
major
quickly.
questions. No major questions, Tom, and quick hello to Abby for joining us. But do you see between the homeless and the seniors, and do you see any trends that are quite worrying to you when it comes to whether the homeless or just kind of just in general with this economy or the situations? Does any kind of trend kind of stand out?
Yeah, I think the trend that I'm finding very worrisome is the seniors falling into homelessness because seniors require more. If you're talking about a young person who is homeless, you can work with them. Maybe they have family, and we had one person recently who, he was homeless and he had family down in the Monterey Bay area. And so he worked with us we were able to get him some transportation down there and get him a little bit of assistance to help him hook up with his family so that and that actually ended up being fairly inexpensive. That's great. Your sister says you can have a room for while you're looking for a place to live down there and getting connected to social services down there. That's fantastic. God bless your sister. So, yeah, so that's great. But I think that's probably the most worrying thing. The
Yeah.
other thing, oh, I'm sorry, go ahead, Diana.
No, I was just gonna say we can have this is a totally different topic. We might have to have Tom back for another session on this topic. But when I think of my own parents, if they were completely able-bodied seniors, it might be one thing. But my mother had a stroke, my father has cancer. If something were to happen and they lose their home for God not willing, I don't even know what would happen in that situation. So just kind of the brain starts thinking differently when you have older parents, and so I'm just kind of like, wow,
Yeah.
yeah.
I'm dealing with that right now with my own parents. Like I said, they're both 90. They live in the Waverly Park neighborhood of Mountain View. If you guys know where Waverly Park is, it's right over by Mountain View High School across from El Camino Hospital. and a nice neighborhood and where I grew up. And but I'm dealing with that now. That they both have given up their driver's licenses. They both are starting to plan, and they're looking at the terraces, and they're looking at the forum, and they're looking all around at all the other places that might be appropriate for them. Thank goodness my dad's still out puttering in the yard, and my mom is sharp as a tack, and my dad refers to her as the CFO in the household because she still manages all the books and everything. But it could change in a moment. And yes, you have to be prepared for that. And the health issues that your parents are dealing with, Diana, it's the same thing. And you can't just tell a senior, okay, go live in Fresno. If you're 25 years old, and you've got a family, and you may not want to leave your hometown, but you can. But if you're a senior, you may not be able to. It may be physically impossible for you to move. And so everything changes, the situation changes. And I think that's why the growing population of homeless seniors is really very concerning to me.
Yeah. No, thank you. Okay, now for the real reason why we brought you here. What's happening in
Yes,
the
let's talk about federal funding specifically. And I've got a couple of quick charts to share with you all. Let me pull that up. Okay. Are you all seeing let me see. For some reason, you're seeing it more than I am, I think. Are you all seeing two pie charts?
Yes.
Okay. We get about 20% of our revenue, and frankly, this is a good thing, that only 20% of our revenue comes from government sources. We get money that comes from the federal government. That all goes through other filters, whether it be United Way, the county, the city of Mountain View. So we get about 20% of our funding from government sources. About 12% of that is federal funds, all that are filtered through these other entities. And so one of the things that I find particularly worrisome is that the amount of, even though it sounds like, okay, well, we've got the city of Mountain View, we've got general funds that come from the city of Los Altos, not significant amount, but an important amount. $25,000 comes from the city of Los Altos. We also get $25,000 from the city of Los Altos Hills. Those are significant in that they are, or I should say, those are important in that they help us to be able to say to folks, hey, your hometown, and my hometown right now is Los Altos, your hometown is contributing to the basic safety nets in your community. And that's important to be able to say to people, even though our total, as a percentage of our total budget, it's not that much. But what is concerning to me is the current changes in the stuff that's coming from the federal government. Federal government funding is at risk, and it's at risk for a couple of things. And tomorrow, I'm actually having a Zoom meeting with CSA supporters. Some of you may have been invited to that, and I will go much deeper into the situation with the federal government in that one, because that has very significant impacts in other ways than funding. But the funding portion of it here, you can see which programs of ours actually get the most amount of funding from the federal government. And then I also put the county here because the county has, has said that they are going to be dealing with major funding cuts as well. So if you look at these two charts, you can see that our homeless prevention services from the federal government accounts for about 9% of our total homeless prevention budget. It accounts, though, for 45% of our senior case management budget and 46% of our senior nutrition budget. So from a federal government point of view, the two programs that I mentioned in my previous slide deck that are most going to see the biggest reduction are going to be our senior case management program and our senior nutrition program. Now, if you go over to the side-by-side pie over there, our county funding, look, and you can see that homelessness prevention is on there for 49%. Advocacy and outreach, these are our people who go out into the community, like the young man I mentioned earlier who's going over to the high schools today and works in the high schools. But look at the next program over, senior nutrition, 37%. So the two government sources of funding that are talking about cutting the federal government and the county, the program that is really at risk is our senior nutrition program, our senior lunch program. But these federal funding cuts have another aspect to them that are really concerning. And that is, to me, and that is that the federal funding is coming with a lot more strings attached. We received a memo from the Office of Housing and Urban Development, which is where most of the funding for low-income programs comes from, like ours, comes from, sent out a memo to all agencies in receipt of federal funds that said, you may not engage in any kind of gender ideology, forbidding us from doing diversity, equity, and inclusion, and including any of that in any of our work. It also banned us from referring or partnering with health providers that provided any kind of abortion services or information around abortion services. And it also ultimately said that and this was I mean, all of that was deal breakers. But the real deal breaker was you have to monitor the immigration status of your clients and keep that available. All of those things violate CSA's values. We do not get into people's personal lives around gender ideology. We have all kinds of folks that come to us for services, and our job is to open the door for anyone who's low income and come into us. Equity and inclusion are important values of ours. And if you look at the makeup of our staff, we're an incredibly diverse staff. 72% of our staff are women, 72% of our staff are people of color. The executive director is a gay man. Diversity is who we are. That's just the makeup of us. But ultimately, I'm not going to put my staff in the position of being immigration agents. That is completely inappropriate for us. We are not trained and able to do that. No matter what your no matter what your feeling is on tracking undocumented folks, I think we can all agree that social workers are not the people who are going to be the most qualified to do immigration services. So all of those things have led CSA to do two things. One is now these requirements that are coming down from the federal government are currently being litigated in the courts and are being challenged. And you might have heard that the city of Mountain View and the county of Santa Clara are both involved in lawsuits challenging these requirements. The outcome of these is unknown. We are going to continue to bill the city of Mountain View for the federal funds that we are supposed to get, and the county as well. So we're going to continue to do business as usual. But our board of directors took the extraordinary step. Those of you who know CSA know that our board of directors is about as apolitical as you can get. We don't go deep into politics much at all. We do, however, recognize that we are living in extraordinary times. And so our board of directors at their December 4th board meeting passed a resolution saying that CSA will not accept funding that comes with those kinds of strings attached. We recognize that at least for now, that puts our all of our federal funding, no matter what source it comes from, at risk. Now, thankfully, we've been very, very smart over the years and said we want to keep government funding to a minimum. So we are not in any, and I want to make sure this is very, very clear to everyone. We are not in a position like you might remember Downtown Streets team several months ago went out of business. And it was because they had way too much government funding. We are not in that position. About 20% of our funding is government, and about 12% of that comes from the feds. So we are going to have to tighten our belts. We're going to have to take a hard look at our services. We're going to embark on a strategic planning process to help us navigate these next 3 years. So we're not in any danger of closing. That said, we are in danger of things running dry, particularly senior nutrition program, particularly our food and nutrition center. And to me, it's just absolutely immoral that you would think that food is one of the first things on the chopping block. But anyway, so we are still awaiting the results of that litigation, and we will know, in at some point whether or not those funds are open to us. But we have taken a stand, like I said, pretty extraordinary for CSA to take a stand on a political in a political way, but we've taken a stand that we're not going to violate our values, and our values are very clear that everyone is welcome to come into this door. And so I don't care if you're undocumented. I'm not even going to know if you're undocumented. I don't care if you're a trans person, and I don't care what the next person's attitude is towards trans people. You're all welcome to come in and get services at CSA. So I think I'll leave that there and answer any questions, because we're getting down to about 15 minutes before people have to start leaving. Yeah.
Thank you, Tom. And I want to open up to the group. Feel free to do the virtual hand or real hand. But I'm going to start off with one quick question, look, Tom. And I know you can't speak for other nonprofits, but when it comes to situations where we're facing right now with the county, with state, with federal, with private donations, the domino effect is real. We all have heard the stories about this like Second Harvest Food Bank not getting enough, and that may impact you. What is like, how are nonprofits in that space, in all spaces, kind of working together still to as much as possible? And maybe let's go and open it up to what can the community do to help?
Sure. First of all, talking about the nonprofit network, and I cannot stress enough the importance of this group that I mentioned, the EAN, the Emergency Assistance Network, and all of these agencies, most of whom have the word community services somewhere in their name. And we were all born out of the war on poverty in the 60s. We were the oldest in 1957, but all born out of the war on poverty in the 60s. We have a very strong network. We work together, and I can tell you that all of us have the same values, that anyone who walks in the door gets help. In fact, we have a phrase that we use called "no wrong door," which means that, let's say someone lives in San Jose, but works as a gardener up in Los Altos and can't get to Sacred Heart Community Services to get their food. Well, quick call be back and forth between Sacred Heart and CSA. And the next thing you know, that person is, as soon as they're done with their gardening work, can come get some food at CSA and then go home to San Jose. So I cannot stress enough the importance of that network. That network does have the same values or similar values as CSA, and will not violate those values. So I think that's good. As far as other nonprofits, nonprofits are much more reliant on government funding, and so it is certainly possible that we may see nonprofits either fold or acquiesce to those requirements that the federal government is starting to put out. I think that the concern that I have is there are nonprofits that are not as financially diverse in their revenue streams as CSA and others. And that's why I talked a lot about the federal money amounting to 12% of our budget and the total government budget 20%. I didn't talk about the other sources of funding that we get to make sure we do have diverse revenue streams. We get funding from corporations. We're very good at guilting Google to give us funding. We get funding from foundations, whether it's the Los Altos Mountain View Community Foundation, the Silicon Valley Community Foundation, and so forth. By far, by far, the most important source of revenue we have, and the majority of our revenue comes from individual donors. And so we make sure that the people in our community know that we need their help. And I it's very easy for nonprofits to start concentrating on 4 or 5 very wealthy people in a community, and I say no. There is a woman right down here, just off of Villa Street in Mountain View, over in the Shoreline West neighborhood, who sends us $20 a year, and she gets the same personal note from me that every other donor gets, because that is our way of saying that, yeah, you belong in this process. Individual donors are incredibly important, and I stress that to people. You can't just go raise money from the foundations. It's got to be from the community, and especially when you're a community-based organization. If you were a big regional nonprofit, maybe not, but we're the hometown charity in Los Altos and Mountain View. We got an obligation to make sure that people are the primary investors in the work we do. So, yeah. And then I think the other thing to bring up is that, and I think this is all going to wait. We are, like with everything right now in the crazy time. May you live in interesting times. Like everything right now, a lot of it's going to be waiting to see what the results of the litigation on this funding, for example. But so much of what we do is based on litigation. I think another thing and I don't go deep on this. I'll probably go a little more deep on this in my meeting tomorrow with our supporters, is that we do recognize that a portion of our clients, the majority of our clients are not undocumented, but the majority of our clients still all live in fear. And so we do have a percentage of our clients who are undocumented. I don't know who they are. I don't want to know, because the first person they're going to start asking questions of if they come to CSA is me. So I can very truthfully say I'm the most ignorant person in the building. However, I think that there is a real fear factor, particularly among our brown and black clients that are legitimately afraid of what might come through the door. So we have protocols in place that we don't. I'll say that's all I'll say about them, is that we have protocols in place for if that happens. Did that answer your question, Diana?
It did. Thank you. So, Ginny, I saw your hand raised.
Yes, Tom, how is your staffing given the impact of all of the need out there?
Well, our staff during COVID, as you can imagine, we didn't close. We were open every day. My husband and I led 2 different COVID lives. He was at home working from home, and I'd go home to freshly baked bread every day and expanded my waistline because of it. But I was at work every day, and we were all at work every day. During COVID, the numbers that of folks that were employed at CSA went up to 42. That was the most we've ever had. We're now back down to, I think, a more regular, what's going to probably be the regular level moving forward, which is 36 folks on staff. And then we have hundreds of volunteers that supplement the work we can do with 36 staff. As far as funding goes, I think that those things that are funded by primarily, because we do fund accounting, as a lot of you might know, fund accounting in the nonprofit world, you you have to account for funds within, each program and that kind of stuff. Uh, and looking at it, the programs that we rely on donor dollars to fund, I think I'm feeling pretty confident about that. But like for instance, this young man who does social work in the high schools that CSA keeps on staff, and the high school district absolutely loves him because he can go deep with folks that they can't. But that's fully funded by federal funds that come through the county. What's going to happen to that position? Uh, the senior nutrition program, which we literally have 200 seniors come to have lunch with us every day at the Mountain View Senior Center. That program is heavily reliant on the government funding, and that's for people, who live right here in Mountain View. Excuse me. These are not jobs that are folks are driving in from San Jose or whatever. These are people who live right here in Mountain View that are employed over there as the cook, the site manager, the kitchen helper, and so forth. So, yeah.
Any other Mark? Yeah.
Yeah, Tom, I was curious about like where you draw the line for qualifying for your services. Obviously the federal power line is a very different place than our local
Yeah.
line is. And kind of like a follow-up to that too is then the folks who don't qualify but are still in this vulnerable space, like how do you direct them, or do you use your network?
Yeah. We do not use the federal poverty line because the federal poverty line is the same in Mississippi as it is in the Bay Area, which is completely inappropriate, obviously. So we use what's known as area median income. And these are figures that HUD actually puts out these figures. The Federal Department of Housing and Urban Development puts out these figures on area median income. And for our services, and for almost all of our services, we use 80% of area median income. So if you are and it depends on the number of people in your household, if you are a single parent, a dual parent, a number of dependents in the household, that's normally kids, but it could be other things, family of four, for example, or whatever. I don't have those figures right in front of me, but they're obviously much higher than the federal poverty line. But area median income is generally a good way of measuring what's available, and 80% of AMI, as they call it, or area median income, is what we use as a guide for most of our programs. Now, some of our programs require 50% AMI or 30% AMI. You might have heard about the basic income pilot that we tried at CSA. And we tried basic income for 2 years. It was money that was funded from the city of Mountain View. That served 30% AMI and below. And so that was a very specific population. Now, you're right. There are a lot of people that are just above 80% AMI or still having trouble making ends meet, particularly younger people who don't have a nest egg yet or a savings account yet, are paying all of their check to rent each month or whatever the case may be. We have people come in who have legitimate issues, but they just don't fall into those categories, and those categories are, like I said, requirements. We do have that network out there. You may have heard that I'm on the board of directors of Hope's Corner. Hope's Corner doesn't care how much money you make. Open the doors, come on in and get some food. And, so if you fall into that category and you don't qualify because you do make, median income or just above median income, but you're in a precarious situation, you might say, go over to Hope's Corner. Now it's only 3 days a week, but those 3 days a week you can get some food, and they'll be able to help you out. Yeah.
Thanks, Tom. And when the AMI is different, the AMI is different, right? So in terms of getting money from the federal government, are you able to use those funds for anyone you want to that qualifies under AMI, or do you only get to use those funds for federal poverty, people that fall below the federal poverty line?
No, we can, any funds that we get from right now.
Hmm. Yep.
Yeah, everything's got, it can all change tomorrow, but for right now, anyone who falls below the local area median income uh, qualifies for our services. There are two issues that I'm particularly concerned about, though, and this goes into the whole things can change tomorrow. You might remember when the government was shut down for that long extended period of time, and they were talking about, oh, we're not getting any economic data. We're not getting any economic data. That was a jobs report. The Fed needed to make interest rate decisions, and Jerome Powell was talking about how he had no federal data to make decisions on. Well, one of the things that suffered because of that is the AMI, and so we had to use old AMI reports instead of monthly AMI reports from HUD in order to rely on it. Luckily, AMI did not change that much during that period, but if the government stops doing statistics again, we could find ourselves in a big heap of trouble. The other thing that's kind of important in all of this and how it can change in a moment is, do you all remember when SNAP benefits were cut because they were not funding, again, with the food? I don't know what the obsession that if Washington is with food for poor people, but SNAP benefits were cut. And it was about a week before they were restored into people's accounts. I was getting very concerned because the weekend they were cut, the Monday afterwards, our line was a little longer. Tuesday, the line was even longer. Wednesday, the line was getting, and this was going on all week long. And I was saying to our folks around here, and I'll clean up my mouth, but I was saying, oh my God, what are we going to do? This could get bad. If this doesn't change soon, it could get bad. And then that weekend, the SNAP benefits were restored, and our lines went back to a more normal place, where a more manageable place. So I think that we're at the whims of a federal government that is kind of chaotic right now, and we just don't know where it's all going to land. But yeah, but people, again, we have those networks so that someone who uh, does not, it falls just above that area median income amount would be networked to a different organization.
Mhm.
I'm going to hand it over to Kim soon, but Tom, I think you followed the Joint Venture Silicon Valley Index report, and like last year, I think it was 2025, where the top three biggest issues that were highlighted from their poll was cost of housing, cost of living, and homelessness. And I don't think
Mhm.
that's going to change anytime soon, and it's also connected and related. So I just want to thank organizations like yours and others that really try and help fill the gap of need. And it's just so important that we just keep doing what we can to support you all. So that
Right.
being said, I'm going to sign off so I can go get pretty and send it over to Kim to finish us off. And unless there are other questions, please feel free to raise your hand or just jump on. But thank you, Tom, for being here.
Thank you, Diana. Nice to see you.
Thank you, Diana. Just in closing there, Tom, really interested to hear more. Maybe we can either have a follow-up session about the basic income pilot and the outcome of that in Mountain View.
Absolutely. We should get some very, very detailed data within the next 4 or 5 months at the latest.
Okay. Okay, great. We'll do a follow-up session. But any other questions for those of you that are here, things that you'd still like to ask Tom? Okay, if not, I'll be sensitive to time. Thank you so much, Tom. Really appreciate your sharing these updates with us. And I know how incredibly challenging it is and that things are changing on a daily basis, but really appreciate the work you do for our community and for the region. So
Absolutely. Well, my pleasure. And I just will finish on a high note. I always tell folks that, I may not ever be the highest paid person in the room. With those of us that work for nonprofits, no. That said, each night I go home and I know that we've been able to feed people and put food on the table. And all of that is thanks to the support we get from a very, very supportive community. So thank you.
thank you. So I'll close out with some announcements here. As you're all aware, this is Super Bowl weekend coming up here in our region. And so we have a weekend full of events planned in Los Altos. We're planning a First Down Festival, which is tunes and touchdowns. So we have live music both Friday and Saturday night. It's our first Friday evening, but then we're also having, I guess we'll call it First Saturday. And Saturday afternoon, the Village Association has their Chaco Super Stroll from 2 to 5 p.m. And then we also have mural tours from Arts Los Altos at 5 p.m. on Friday and Saturday as well. And then live music pregame Sunday at our restaurants in the area. So love to have you come out and support and enjoy the events on this Super Bowl weekend. Two upcoming networking events. We have February 25th at Villa Siena. That's a dual chamber mixer with the Cupertino Chamber of Commerce and Los Altos Chamber from 5:30 to 7 p.m. at Villa Siena. And then on March 25th, Poppy Bank in downtown Los Altos will be hosting our networking event at the same time, 5:30 to 7. And then just for a note on your calendar, please save the date for State of the Cities, which will be May 8th. And we look forward to seeing you there. That's a Friday, May 8th. Any other announcements from any of you that you'd like to share? Mark, Scott, Abby, Julie?
Nope, you covered everything for the weekend. Thanks, Kim.
Okay,
Appreciate it. Thanks for putting things together.
of course. Happy to have you all here today. Thanks for turning out. And then, as always, we do record the session to share with our membership and post online as well. So great. Thank you.
Thank you, Tom. Thank you, Tim.
Have a great day.
Bye.
Bye-bye.
Thanks, Tom.